Well, like most communities, I mean, Sisters has a lot of risk within the community. And being a smaller community, sometimes it's difficult for the career firefighters or administrative staff to do all of the projects and programs that we'd like to be able to offer the community that are really essential to reduce risk and to save lives. And so from that need, developed the Fire Corps program.
The Fire Corps program leverages the unique skills and abilities of Fire Corps volunteers to mitigate community risks.
There's a tremendous amount of people in the community that have skills and experiences that really line up. Maybe they're a retired nurse, maybe they're retired law enforcement, some retired fire professionals. And they still have a desire to serve, and they still have a desire to give back. But without an outlet to serve, without an opportunity to do that, and without somebody asking them to serve, they weren't engaged.
These talented and dedicated volunteers provide valuable and often life-saving services, such as blood pressure screening, CPR first aid classes, car seat safety checks, smoke alarm inspections and installations, and a wide variety of safety and prevention programs. While this volunteer Fire Corps program provides important services to the community members, it also benefits the volunteers who are doing the work.
People, whether they're retired or still working, they want to be engaged, they want to be valued, they want to use their skills. And so if you provide the opportunity for people to do that, every community has people that would be interested in doing this.
While many of the programs focus on safety and prevention, the Fire Corps volunteer is expertly trained to address each stage of a medical issue.
We teach community first aid and CPR so that all of our citizens, the hope would be that the entire community is educated on how to perform CPR and do first aid. Then we connect that with the Pulse Point program. So now we have a trained community that receives cell phone text messages if somebody is having a heart attack near them, and they are notified and able to go help. The next step is community access to automatic defibrillators. We have over 50 defibrillators within the community as part of our Fire Corps program, so that we have trained people that receive a message through Pulse Point and they have ready access to AEDs. Then the next step is our paramedic firefighters that can then integrate with all of these other services to transport the patient, do advanced life support care, and hopefully save additional lives.
How big of an impact is this program having on the community? Fire Chief Roger Johnson shares what he has observed over the years.
The fall prevention program, we're starting to see some benefits to that. We have a lot of anecdotal evidence, especially with our blood pressure screenings. We've identified several patients who were on medications that were conflicting with each other and whose blood pressure was just off the charts high. And we were able to recommend that they follow up with their healthcare provider. We've received letters from those people identifying that their doctor told them if they would not have had the blood pressure screening, they likely would have died. So we do have a lot of anecdotal one-off, and we are starting to see through our data changes in our emergency responses, we believe as a result of the prevention programs we're providing.
Could other communities successfully establish this kind of program?
Well, the beauty of the Fire Corps program is it's actually a federal program sponsored by FEMA. So a lot of the structure and the format and the programming is already available and easily duplicatable for any community. So I think that's one of the neat things about it. And we're a small community. We only serve about 7,000 people. But we have 27 Fire Corps volunteers out of a community of 7,000. So I'd say that any community could easily replicate it. It's just looking at what's available, identifying what your need is, and then asking for help. The community will respond. If you have a true need, you have a meaningful work, you ask for help, and then you reward the people when they participate in the program.